There's been this conversation on capping in the contribution of Social Health Insurance Fund. The Health Cabinet Secretary Susan Nakhumicha is ruling that possibility out. The CS says that the high earners will have to contend with the fact that they have to dig a bit deeper into their pockets in order to help fund that kitty, even as she defended the benefits offered under the new scheme. High earners, led by members of parliament, had suggested that the highest contribution to the kitty should be capped at 5,000 shillings. Nancy Okware with that report.
On the second day of the validation exercise of the social health insurance regulations, it was time for the Joint Committee on Health to sieve through the regulations. The legislature has taken issue with the 2.75% contribution that will see high earners contribute more.
Because I calculated the money I spent on Arambes on weekends for sick people, I spent almost 200,000. So I would rather pay this 22 if you give us the assurance that nobody will ever put us in any WhatsApp group for Arambe.
From going across the country, from the communities, none has given us a suggestion on capping, because then they are able to see what it is that we are trying to do. If we impact by capping, we will impact on the expected yield. We will compromise the yield. If we compromise the yield, we will go back to the issues that we are facing.
The legislature has also poked holes into the provision that requires those with more than one spouse to make additional monthly or annual premium for each additional spouse.
If you treat a household with two wives as two households, isn't that double jeopardy?
But I think let us go for the definition of the household and recognize polygamy in that sense, and say in case of polygamy, every other is a household on its own. Because otherwise you are going to have a problem.
If you pay the extra premium, it will cover the second household. So the children will not pay any other premium. The extra premium is for that household. Whether she has one child or 10 children, it doesn't matter.
The ministry was also at pains to explain how 25-year-olds without a source of income, who will be considered as a separate household, will manage to raise the 300 shillings monthly.
Surely, where do you expect this young man to get this money from? And even from your own drafting, by the way, you are clearly telling us he has no income. And you are still insisting he needs to pay 300 shillings.
We have still not come to a conclusion on some of the areas that we are pinpointing. And the purpose is for us to give recommendation and to give our views, so that as we put together the final document, you represent a very, very huge constituency. And that is, those are the members who are going to be affected.
Registration to the Social Health Insurance Fund will begin in the first week of March and will continue for 90 days. Contributions are set to begin on the 1st of July 2024. Amid calls for a review of certain aspects, the Ministry of Health says that it is ready to transition to the Social Health Insurance Fund, with the registration process set to begin in the first week of March. Nancy Okware reporting from Afya House, Nairobi.
Now, residents of Yatia in Saimo Soi Ward in Baringo North have fled their homes following the killing of 2 children by armed bandits Monday evening. The children, aged 11 and 17 years, met their deaths yesterday on their way from school when bandits accosted them, killing them on the spot. An unknown number of livestock were also stolen during the attack. Irene Muchuma Odim reports.